I am going to go over an important aspect of your life that will have a great impact on how you feel with rheumatoid arthritis. What is this aspect of your life? It is sleep. Yes, studies have shown that sleep is deeply connected with pain, inflammation, fatigue, brain fog, and all these symptoms are experienced by my patients with rheumatoid arthritis. We will discuss about how can poor quality sleep or insufficient amount of sleep will impact people with chronic pain and rheumatoid arthritis. What happens when you are chronically deprived for years, and we'll also discuss how long you should sleep every night. But I will also give you 7 tips that you can use to sleep better and experience less pain. Let's dive in.
Rheumatologistoncall.com.
Hello everyone, I'm Dr. Diana Girnita, the founder of Rheumatologist on Call, that is a telemedicine company helping patients with arthritis. Let me start by asking you a few questions. Have you ever found yourself wrestling with your pillow, struggling to get a good night's sleep, then waking up the next morning feeling like you have been hit by a truck with pain levels that are off the charts? If you have experienced this, you are not alone. Many patients that I see in my practice, rheumatologist on call, report feeling worse the next day after a night of poor sleep. Have you experienced that? Now, sleep, it is not just about rest and recharging your battery. It is a critical factor in your overall health. Over the last 10 years, there are numerous studies that highlighted that inadequate sleep leads to brain fog, tiredness, and increase in the pain sensitivity. Now let's dive into the impact of sleep on rheumatoid arthritis. Unfortunately, for many patients suffering from rheumatoid arthritis, a good night's sleep remains very hard to obtain. There are many reasons that sleep can be affected, such as active rheumatoid arthritis, certain medications, or other comorbidities like obstructive sleep apnea or restless leg syndrome. Now, studies like this one show that 60% of people with arthritis report poor sleep quality, and they average about 5.7 hours of sleep per night. People in pain have poor sleep quality because they frequently wake up, they readjust position, and they sleep fewer hours. However, sleeping less or having poor quality of sleep will also lead to more pain the next day. So there is a bidirectional relationship between pain and sleep. This is one of the most profound effects of inadequate sleep. It will amplify your pain sensitivity, the way that you're going to feel the pain. And there are studies that show that people suffering from poor sleep, they will perceive pain 10 times worse than those that will sleep well. In my clinical experience, patients consistently will tell me about a direct relationship between the quality of their sleep and the severity of rheumatoid arthritis symptoms. Those with shorter or fragmented sleep often find themselves experiencing more pain the next day. On the flip side, restful and adequate sleep will reduce pain levels. Now, what happens when you are chronically sleep deprived for many years? Years of poor or insufficient sleep will lead to chronic sleep deprivation, a common struggle for many patients with rheumatoid arthritis. This results in severe fatigue, increased anxiety, depression, and a perpetual state of insomnia. More than that, chronic sleep deprivation leaves people with rheumatoid arthritis grappling with debilitating fatigue. Studies like this one shows that people with poor sleep are more fatigued, more depressed, and in more pain. And this fatigue becomes a significant hurdle, causing difficulties to engage in physical activities and impacting the choices that you're going to make about your nutrition. When I discuss sleep with my patients, I have to take a comprehensive approach. I start with better managing their arthritis to decrease their inflammation levels. I assess the medications that can impact their sleep, and I evaluate patients for other conditions, like I said, obstructive sleep apnea or restless leg syndrome. How long should you sleep every night? To improve how you feel with rheumatoid arthritis, it is recommended to have a good quality sleep and to sleep for about 8 to 9 hours per night. Now, I will keep my promise and I will give you the 7 practical tips to enhance your sleep quality. And these are the tips that I share with my rheumatoid arthritis patients. Number 1, lower the thermostat, because keeping your room temperature slightly cooler, about 65 degrees Fahrenheit or 18 degrees Celsius, will help you sleep better. Dropping the temperature will facilitate the natural temperature to drop your body and will prepare you for sleep. Number 2, your bedroom. Designate your bedroom as a sleep and intimacy sanctuary only. Eliminate work and any entertainment activities. These mental associations help you signal your brain that it is time to wind down. Number 3, establish a bedtime routine. Dim the lights 30 minutes before bedtime to trigger your body recognition of sleep time, and reintroduce a bedtime routine. Activities like reading, listening, calming music, or meditating. Number 4, watch your evening activities. Avoid heavy meals, exercise, and alcohol close to bedtime. Finish these activities at least 3 hours before sleep to prevent disruptions. Number 5, unplug. Power down electronic devices at least 30 minutes before bedtime. The blue light emitted by those devices can interfere with melatonin production, which can make you fall asleep harder. Number 6, relax and unwind. Incorporate relaxation techniques like mindfulness and deep breathing. Take a deep breath. A warm bath or a tea can set the tone for a restful night. Number 7, aim for consistency. Develop a consistent sleep schedule by going to bed and waking up at the same time every day. And aim for 7 to 9 hours of sleep per night for your optimal health. I hope this video made you understand better the connection between your sleep, pain, and arthritis. Try these tips and let me know how they work for you in the comments below. If you find this video helpful, make sure to share, like, and subscribe for more tips about how you can improve your life with arthritis or rheumatoid arthritis. Until the next time, I hope you have a restful sleep. Thank you for watching.
Rheumatologistoncall.com